There's some classic signs here of a cold sore with a cold weather as a trigger. The patient has been using his treatment for 12 days and the acyclovir cream available over the counter, you can only sell it for a maximum of 10 days treatment. We can class this as a treatment failure and therefore the patient needs to be referred to his GP. You could give him some non-pharmacological advice, in particular with the cold weather being a trigger, maybe advise him to wear something like a scarf. Athlete's foot is a superficial fungal skin infection and it affects the feet and the toes. It's quite common, 15 to 25% of people can have it at any one time, and it's more common in men than it is in women. Anyone can get athlete's foot. It's more common in people who sweat more. It is easily passed on from person to person, and once a small patch of infection develops, it can quickly spread along the skin. Usually there's itchy, flaky skin in the web spaces between the toes. Most cases are quite minor. The flakes become white, emaciated and peel off. And then under the skin it can become red, itchy and inflamed. If the skin is broken, there's risk of a secondary bacterial infection, so you need to look out for weeping, any weeping, pus or yellow crusts. If you see any of those signs of bacterial infection, that will need to be referred, along with if any of the nails are affected and if it's quite severe and affecting other parts of the foot. Any diabetic patients should also be referred, because if treatment isn't started quickly, this could go on to develop a foot ulcer for them. There are lots of different topical antifungal treatments available. They come in lots of different formulations, so you can discuss the best formulation for your patient. It's good to continue treatment some days after the rash has gone, and this helps to prevent reinfection. The azole antifungals are generally applied 2 to 3 times a day. They are available in creams, powders and sprays, but they can cause some mild irritation to the skin. Terbinafine is available in a cream, spray, solution and gel, and is available for those aged 16 years and above. Mycil is available in several formulations, so powder, cream, aerosol and solution. It's used twice a day for up to 6 weeks, although it can cause stinging. Grisol solution is used only just once a day and can be used for a maximum of 4 weeks. Corticosteroids are generally not recommended for athlete's foot alone, but they can be used in combination with an antifungal. So here we've got Canesten HC, and that can help with the itch. Some practical tips you can give. Tight shoes made of synthetic materials make it impossible for moisture to evaporate and therefore the feet become more sweaty. Leather is better because it allows the skin to breathe more. Cotton socks facilitate moisture evaporation, whereas nylon socks prevent this, so it's much better to go for cotton socks where possible. You should wash and dry feet thoroughly before applying antifungal cream, particularly in between the toes. It is very contagious, so when you should really avoid walking in bare feet, and if you're at something like in sports changing rooms or swimming pools, try and wear flip-flops to prevent spread to other people. Nail infections are a cause of deformed nails. The affection tends to evolve quite slowly and it's most commonly caused by a fungal infection. It can either affect a part of the nail or the entire nail. Nail infections are more likely with increasing age. Also, if you've had athlete's foot, because obviously you've already got a fungal infection there. Any previous nail infections that haven't fully healed, or current nail infections where you've got close contacts, they might spread onto the next nail. Some other common causes are things like diabetes and psoriasis, whether you've got an immune a weakened immune system, as we've discussed in previous lectures, and smoking. Some signs and symptoms: the skin becomes quite thick and discoloured. It might be white, black, yellow or green. There can be discomfort, then the nails can become quite brittle and the skin around the nail can become inflamed and painful. So here are some lovely pictures to show you some examples. We need to refer if walking has become difficult or uncomfortable. If there's any predisposing conditions, so things like diabetes, any problems with peripheral circulation, or whether they're immunocompromised, whether that's through medication or medical conditions. For these patients, you might need oral therapy rather than a topical therapy that's available over the counter. If there's any nail destruction, or if more than 2 nails are affected or more than half a nail has been affected, then those will need referral too. Anyone under the age of 18 years, and if treatment has been tried and failed. Treatment might not necessarily be required. It would be up to the GP to decide that. But there are some self-care methods that we can recommend. There are some over-the-counter treatments, and prescription only, there are some antifungal oral medications that the patients could have. There are some nail paints available over the counter. Although treatment is very slow, it can take up to 12 months. And application depends really on the product. Some are just only once a week, but it's best to use the preparations available rather than using normal nail varnish. There are many different products available, and it's recommended to file down the nail before applying any of the products. Practical advice is very similar to that with athletes, but some additional things are keeping the nail short, using separate nail clippers for the infected nail rather than the healthy nail, and once the nail has healed, to replace any old footwear, because that can help to avoid reinfection. Our next scenario in your busy community pharmacy, I've changed slightly to adapt it towards more like the style of question you could get in an exam. So a man comes into your pharmacy asking to buy something for athlete's foot. He's got no referral symptoms, so you recommend clotrimazole antifungal cream. What non-pharmacological advice could you give and why? And then we'll go through this in the next screencast.